I'm François Cornelis, I'm an interventional radiologist at Tenon Hospital, Paris. We are performing in our center some vascular intervention and also interventional oncology. This morning we performed HBP embolisation. It's quite a standard procedure in hospital. We are using for this purpose a cone beam CT from General Electric and all the software available from GE. In particular, Embo ASSIST. Currently, the challenge with HBP embolisation are to be effective, firstly, and also to trying to avoid complications. The reason is because the anatomy is quite complex, and there is also a lot of anastomosis from the prostatic arteries, and then we need accurate imaging software and hardware to guide the procedures. Firstly, we have to lean the patient on the bed comfortably because the procedure could last almost 2 hours. And then, under local anesthesia, we are catheterizing the iliac arteries from one side, then to the other side. When we are in place, we are performing a cone beam CT and we are using the software trying to identify the arteries. And then we are performing the embolisation and using the same cone beam CT we are trying to identify the anastomosis and the contrast uptake after the procedure. The GE cone beam CT provides high quality image. We are also very familiar with the use of the software and also the remote control on the table of the CBCT. The software allows us to navigate in the arteries, and we are using currently Embo ASSIST. And in some cases, we are using the digital zoom and also motion freeze. We perform an embolisation of an angiomyolipoma. This angiomyolipoma measured 10 centimeters, and we were trying to avoid complication on the renal parenchyma. Firstly, we perform a cone beam CT from the renal artery to visualize the normal anatomy and the lesion. Then we perform the embolisation after catheterization of the arteries to the angiomyolipoma. Finally, we control the embolisation using the cone beam CT too. In such cases, we are using the cone beam CT and the high quality image of the cone beam CT. We are also using several software available in this CBCT. Firstly, it's Embo ASSIST, and secondly, motion freeze, trying to avoid all the motion artifacts. We are also using the remote control on the table of the cone beam CT, allowing us to manipulate all the images by ourselves, allowing us also to earn time. The key challenges for this procedure is to allow a perfect embolisation and avoid complication by the embolisation of normal arteries of the kidney. The software, in particular in the cone beam, are helping us to place the microcatheter in the exact location of the optimal embolisation. The main reason is because we are using alcohol or glue to perform such embolisation, and it's absolutely mandatory to avoid any complication on the normal parenchyma, in particular in such patients who may encounter several tumors in their life. Cone beam CT and software like Embo ASSIST are helping us to improve our standardization of the procedures. In our practice, Embo ASSIST helps us to decrease the number of DSA and thus the dose to organs and the dose of contrast media. The GE solution helps us in our practice by reducing the variability encountered every day.